Now, another one of the things we've talked a lot about that goes hand in hand with the testing is then doing the contact tracing afterwards. So again, just the high level of this is we test somebody when they are identified as positive, we contact that person and ask them to isolate, and then we go back and review their contacts for the last 2 weeks and get those people to quarantine and ask them to monitor their symptoms. So this is an important part of how we tackle the virus head on, to focus on the people who are directly impacted, to allow us to be able to start loosening some of these restrictions on everybody else so everybody else can start living a more normal life. So with that, I'd like to actually call up one of the folks who's really been a key member of our team, Felicia Quintana Zinn, who is going to talk more about this contact tracing. We do have about 277 team members, DHHS or other department team members that are trained up to be able to do this. We're working toward our goal of getting 1,000 contact tracers to be able to supplement the work that the local public health departments do. Again, this is typically something local public health departments have done, but with the huge volume of work, we the state are standing up teams to be able to help them out. And Felicia is going to tell us a little bit more about that work. So Felicia, please come on up.
All right. Can I move these?
Sure.
I'm just really short. All right. Hi, everybody. So I'm going to talk to you a little bit about contact tracing, what that actually really means. So I'm sure you've heard it quite often, that term throughout kind of this pandemic and what we're experiencing right now. But what it is it's essentially an investigation or detective work. And what the goal for this is to figure out who has been exposed to a contagious disease, something like measles, or in this case, coronavirus. And the overall goal for contact tracing is really to quickly identify who has been exposed, who might have been exposed, and really stop the spread of the illness as quickly as possible, and really help protect, those family, friends, or other community members that might have been exposed. So really, how does it work? So when it all kind of starts with a positive test, so what happens is the local health department or one of our DHHS contact tracers will reach out to the person who tests positive, and they'll provide them some information as to isolation, what that means, and kind of what they need to do. And then they'll ask for some information, some basic information about themselves, who they could have exposed, what interactions they had and what they look like, to really identify who might be at risk. And then they also will go and reach out to those individuals who have been exposed and contact them, let them know, and kind of go from there. So if you are contacted by one of our disease investigators or contact tracers, you can expect a couple of things. One thing, if you test positive, one thing that's helpful to have on hand is probably a calendar to help you remember and jog back your memory for what happened over the course of a specific period of time. So what they're going to ask is when you started feeling symptoms, what those symptoms are like, if you've been in the hospital with COVID, if you have any other pre-existing medical conditions, and who you've had close contact with over the period that you've had symptoms, and then 48 hours prior to that. So 2 days prior to starting symptoms, who you've had contact with. And so when we say close contact, we're not talking about just passing somebody in a hall or in a grocery store. We're talking about being within 6 feet of distance for over 10 minutes with that individual. And so that's where that calendar can really help, is to really sit there and kind of go back into what happened over the past few days. And then if you are a contact, so somebody who has been exposed to this individual who tested positive, what you can expect is that a contact tracer will reach out to you. They'll let you know that you had a likely exposure. This is kind of what you need to do next in the coming days. And then they will really give you recommendations to reduce your exposure to others. And so if you are experiencing symptoms, one of the things that really helps is to tell them that you're experiencing symptoms, because there will be next steps that are going to be a little bit different for you if you're already experiencing symptoms. So overall, the biggest help that you could provide if you are contacted by a disease investigator or contact tracer is really just to be open and honest with them about what you're experiencing. That's really going to be the biggest help and the biggest key. So with regards to the information that they do collect, this information is protected health information. So information that you're providing to these individuals, they are trained staff, and they are there to help and make sure that we don't expose any other individuals and really try and stop this as quickly as possible. So the information doesn't get shared with other government agencies or the public. It really just is there for public health to really work and stop the spread of this disease. So prior to coronavirus, typically we have about 30 or so contact tracers or disease investigators throughout the state. That's really, with where we're at right now, that's not enough people, because this is a lot of time on the phones and talking with people. So we really needed to ramp that up and help support our local health departments, who are really the boots on the ground and who are taking the brunt of all of this. So currently DHHS, we're assisting and supporting the local health departments. We have trained, like the governor said, 277 DHHS teammates from public health and other divisions like children and family services and developmental disabilities to really help increase that number of tracers. And really, this is a department-wide effort. This is a public health effort. This is a group effort that we're doing, not only with DHHS, but also with the local health departments. And we're all working to assist and support each other through this. And so DHHS is also, for the long term, we are working in collaboration with the Department of Administrative Services to really ramp up the contact tracers even more for longer term. And our goal is to get to that 1,000 contact tracers that the governor just said. So that's all.
Great, thank you, Felicia.